These cosmetic treatments are super popular, but very few celebrities are admitting to having it done. Now, Jada Pinkett Smith, Kourtney Kardashian, and Kim Kardashian have admitted to undergoing these procedures, but even though a ton of people in Hollywood are having it done, very few are being upfront about it. So, on this podcast, we're going to be talking all about plastic surgery of the private parts. Yes, plastic surgery of the private parts. And there are organizations like the American College of Obstetricians and Gynecologists who have been very upfront and open in basically saying that they don't think these procedures are worthwhile and that women should stay away from them. So, what are they? How do they work? And what may, I guess, these do for you if you're considering them? So we're going to talk all about it on this podcast today, both for men and for women. And I'm going to break down the studies and the science and whether I think these procedures work. Okay, so we're going to start by talking about the private part cosmetic procedures, first of all, for women. And then later on this podcast, we'll talk about it for men as well. And the first treatment that I'm going to talk with you about is probably the most commonly one done in the operating room, and that is labiaplasty. So labiaplasty surgery is an operation that plastic surgeons are doing all across the country. I have done a little of it. It's not my thing, I'll tell you. These procedures, I kind of stay away from that area, but these procedures are very popular. So let's talk about labiaplasty and exactly what it is. So the first thing you need to know is that there's a difference between the labia minora and the labia majora. Now, if you've never taken an anatomy class, you may not know what it is, but the labia majora are basically the mounds of tissue on either side of the vaginal opening. The labia minora are basically the areas of skin right next to the opening. And that's what you essentially treat in most labiaplasty surgeries, is the labia minora. And essentially, if that labia minora, and we're just going to call it the labia, if those labia become excessively long, if they get torn, let's say during the process of giving birth, then sometimes it can create a functional problem. Some women find that when they're, let's say, riding a bike, they can get pinching of the labia there if they're kind of excessive in how much is there. Other women say that can really impact the sexual experience, the intercourse, essentially. And so there is a functional reason for some people to have this operation done, where essentially a plastic surgeon trims or cuts off portions of the labia minora to make it smaller. But really, in general, this is a cosmetic procedure. And so in general, I would believe that most women are having labiaplasty because they want the labia to look a certain way. And there are doctors out there, and honestly, like as a male physician, like I don't do this procedure, but I see men who are advertising it and saying, oh, get a pretty vagina, even though it's not the vagina, it's the labia, but people get it mixed up. And it's just kind of creepy, honestly. It's kind of creepy. So this is a bit of a controversial operation. I don't have anything against it. If somebody wants a labiaplasty, then by all means, that's up to you. I just find that it's kind of creepy when you get like old men who are advertising it and talking about it. And I tell you, I've been at plastic surgery meetings where they have a labiaplasty session, and you go to it, and there's a labiaplasty session where essentially you have a big table up front, and then there are a handful of doctors up there who are the quote unquote experts of a procedure, and they talk about the procedure. They explain how they do it and ways to make the results better. And then the audience is typically made up of other doctors who are basically learning from them. And so I've been at meetings where you have a labiaplasty session, and it's like 4 old white male doctors sitting there talking all about labiaplasty. And there's not a woman in sight, and these aren't even young doctors sometimes. They're like really old doctors. And I don't know, the whole thing, it can get so creepy. So once again, most of the time, labiaplasty is probably done cosmetically. I do feel that there is a controversy there, because is there such a thing as a truly like perfect or aesthetic labia? I mean, there are doctors who I guess believe so. But really, all labia look different. There's not one way that all labia should look like. Now, that being said, there are reports and there are even studies that have looked at whether there are men who watch a lot of pornography who look at women in porn and then they tell their wives or their girlfriends, why don't you look like them? And try to encourage them to undergo labiaplasty so that their labia can look like the labia of porn stars, which is just not realistic. And so labia come in all different shapes and sizes. Once again, if somebody has a functional issue with them, then by all means, if it improves your quality of your life, then I encourage you, talk with the doctor about it. But at the same time, I do think that there are situations, and I just see as a plastic surgeon who does tummy tucks and breast lifts and implants and stuff like that, I do not uncommonly see a male partner trying to push their female partner to undergo cosmetic surgeries. I wouldn't be surprised if there's that type of thing going on with labiaplasty, possibly to a greater extent as well. And that, as a doctor, as a husband, as a father of a teenage daughter, is just gross to me. Ugh. So there is that question, are women really being shamed into having a procedure that they don't need and that is meant to conform to the quote unquote aesthetic standards of somebody who maybe watches a lot of porn? Like, just the whole thing is just ridiculous. But that's labiaplasty surgery. The operation can be done under a local anesthetic. It can be done under sedation. It can be done under general. I know of doctors who are doing labiaplasty on patients in their offices under a local anesthetic, which to me, I'm not a woman, but that sounds horrific to me. To take a needle down there, you got to numb the area up. It just seems like it'd be so painful. And maybe they've got some secret to make it not painful. But if it was me, I would think I'd want to have at least a sedation for it so it would be easier to undergo. So that's the deal with labiaplasty. Once again, it is a real operation. It's not as controversial in some ways because of the operation is honestly relatively simple. It does work for what you're trying to do, but the question is are some women being shamed into having it done? And is the whole thing just kind of silly, when you're looking at it from a truly cosmetic perspective? Okay, so let's shift gears, and now I'm going to talk about vaginal rejuvenation. So what does vaginal rejuvenation mean? Well, essentially, vaginal rejuvenation is taking the vagina and making it different either by surgery, which we're not going to focus on surgery here today because that's something that's been established, a long time ago, or by different types of devices to try to make the vaginal canal tighter, to make it more lubricated, to improve the experience for both the man and the woman. And so what do vaginal rejuvenation treatments do? Well, essentially, they heat the inside of the vagina. All these basically function to heat the inside of the vagina. And once again, the idea is that supposedly it can create tightening, increase lubrication, and make it for a better sexual experience. There's also claims that these procedures can even improve urinary incontinence. And so there are two different types of vaginal rejuvenation devices out there that are being used throughout the country. There are lasers and there's radiofrequency. So lasers, some of the names are Mona Lisa Touch. They all have these silly, feminine names. So there's the Mona Lisa Touch and the FemiLift. There are other ones out there as well. And essentially what these lasers do is that they laser or heat the inside of the vaginal walls, causing thermal damage to it. And as the collagen kind of heals and as that tissue heals, the idea is that it gets tighter and that you get increased lubrication, you get increased vascularity or blood supply, and supposedly once again, the sexual experience is improved. So those are lasers. And then there's radio frequency. They go by device names like Thermiva and Vaviv. And these don't cause thermal burns inside the vagina, but they use radio frequency energy to create more deep heating of the tissue. And typically they're a little more easily tolerated than the laser treatments because you're not actually burning the actual tissue. You're just kind of deep heating it. That being said, deep heating of RF, radiofrequency, can be painful too. My understanding is Viviv, which is the one that is probably the most recently released, from my understanding, is very minimal discomfort with the treatment. Now, I don't do any of these treatments. Once again, as I said at the beginning of this podcast, I stay away from this area, but I'm pretty well versed just because these are things I obviously want to know about because I get patients who ask me and I want to make sure that everybody has good information. So RF and laser treatments can be used to heat up the vaginal walls, the vaginal walls, and the idea is that you can get both a not really cosmetic, but you can get a functional improvement with it. And I honestly have taught to nurses and patients who've had these treatments done and who have claimed that these have, for some of them, completely changed their life. There was a nurse that I work with, and she is on the older side. She went through menopause, and she did not have intercourse with her husband for years after menopause because it was painful for her. And so for her, she ended up having one of these treatments done, and she said it completely changed her life. And she was kind of a walking poster child for them of how much it really helped her. But what does the science say? Is there proof that these things actually work the way that doctors are advertising that they do? Well, I think first of all, it's important to realize that these devices in general are FDA cleared for safety, but not FDA approved for cosmetic use. So what does that mean? Well, these devices may be FDA cleared because you can use them to treat things like lesions, skin lesions inside the vagina, but they're not necessarily meant, or they haven't necessarily been tested and proven and approved by the FDA to use cosmetically. That being said, doctors will then use them off-label as a cosmetic type of a treatment or as a functional treatment like we're talking about in regards to vaginal rejuvenation. And because that's something that the whole process allows us to do. You know, using something off-label is not illegal. It just means that a device, let's say, has been cleared by the FDA for use for a different use. As a physician, you can basically make your professional decision that you can use it for a different use than what it was cleared for. And if you make that professional judgment, then there's technically nothing wrong with that, unless your judgment was wrong. But legally, that's something that can be done. It's done all the time. You know, so for example, Botox is FDA approved for the glabella, which are the frown lines between the eyebrows, for the crow's feet, and for the forehead. But for many, many years, it was just FDA approved for the glabella, just for the frown lines. But we still injected other parts of the face because we knew it could work well that way. It's just that it took the company many years to go through the whole FDA approval process so that we could do those other areas on label, essentially. So something just to be aware of is that these devices in general have not been FDA approved for vaginal rejuvenation. They've been FDA cleared for other types of purposes. So what do the studies show? Well, there was a study in 2021 published in JAMA, the Journal of the American Medical Association, and it was a sham-controlled, double-blinded, randomized clinical trial that included 90 women with postmenopausal vaginal symptoms. Sham-controlled meaning that of these 90 women, then most likely half of them they treated with the actual treatment, and the other half they inserted the device but didn't necessarily turn it on or didn't use the treatment to the level that was considered a therapeutic level. So you want to make sure that the patient has no idea of what they're having done, and so you do insert the treatment. You just essentially don't turn it on. Or if you do, you turn it on at such a low level that it's not going to do anything. And that way you can get a very powerful result so that okay, if it works or it doesn't, that people can't be faking it or something like that. So after 12 months, the treatment with the fractional carbon dioxide laser compared with the sham treatment resulted in no significant difference between the two groups. And so this trial of 90 women in 2021 did not show any difference in women's, experience, whether it was a sham laser or the actual one. But that being said, prior to this study coming out in 2021, there were multiple small studies that did appear to show improvement in women's symptoms with, let's say, their sexual experience, discomfort during intercourse with these types of treatments. So the jury's kind of out. I do believe, honestly, that these do in general work. If I had to pick one, I would probably pick a radiofrequency one like Viviv, because once again, you're not burning the actual vaginal walls. But I would also let the patients know, that there is a lack of strong scientific data to prove that these devices all work. There's some data out there, but how strong is it? Well, let's talk a little bit about what the FDA and ACOG say. So in 2018, there was an FDA statement, and I'm going to read it verbatim. We're warning women and their healthcare providers that the FDA has serious concerns about the use of these devices to treat gynecological conditions beyond those for which the devices were approved or have been approved or cleared. So they're very concerned about these treatments. This was back in 2018. At a similar time, the ACOG, American College of Obstetrics and Gynecology, had a statement as well that patients should be made aware that surgery or procedures to alter sexual appearance or function are not medically indicated. They pose substantial risk, and their safety and effectiveness have not been established. So this is just a blanket statement for all of these types of treatments by the College of Obstetrics and Gynecology that these treatments have not been proven and they may pose significant risk. And so it is kind of a buyer beware situation. Once again, I know doctors who do these treatments. I previously on this podcast several years ago have interviewed doctors about these treatments, and some of the stories coming out of patients having these treatments done can be truly life-changing. And so it is something to do your research if you're going to consider vaginal rejuvenation treatments. Once again, if I had to pick, I'd go with RF like the Viviv, but talk with your doctor. You also want to make sure that your doctor, these are situations where most doctors don't have more than one of these devices. And let's say they bought a device 8 years ago and they're not doing it a ton. They're not going to buy a newer one. They're going to stay with the old one. And do you want old technology being used on you if there's something better out there? And so in general, what I recommend for these types of treatments is research the individual lasers that are being used and make sure that the doctor doesn't have an old version that they're just sitting on. It's sitting in that back room and they're just using it because they paid it off and it's cheap for them. You want to make sure that the device you're using is the best one out there. Okay, so that is vaginal rejuvenation. Some people call it laser vaginal rejuvenation. Some people call it the designer vaginal rejuvenation. All this stuff, it's kind of silly. Okay, so that's what that is. And once again, I think that it works. It's just be careful. Okay, so there are two other treatments that I'm going to talk about for women's kind of plastic surgery of the private parts. This is not actual surgery. These are injections. And the first one is called the G-shot. No, you heard that right. It's G-shot, not G-spot. And this was one of the original injections to improve the sexual experience, where essentially it's injection of a hyaluronic acid filler into the G-spot area or the Grafenberg spot. And the idea is that if you inject filler into that area, it causes that area to be more swollen, to be essentially larger, and people report that it may improve the sexual experience. I don't know if that works. It sounds kind of silly to me. It's going to hurt because you got filler being injected inside your vagina. It just, I don't know. The good thing is it's filler. Filler can last a long time. They usually recommend a hyaluronic acid filler. You can get a good 6 months or more out of that. There are people who say that this has worked. I have not seen any studies on it. It's probably not all that harmful. So I guess if you want to try it, then that's on you. It's just kind of strange. And obviously part of it is just funny because it's the G shot instead of the G spot, kind of funny. Okay, so there's that one. And then there's another one called the O shot. So what's the difference between the G shot and the O shot. So the G shot is HA filler injected into the G spot. The O shot is injections of PRP or platelet-rich plasma into the area of the women's private area. So you can inject it into the clitoris, into the labia, into the G spot. You just take PRP, which means essentially you draw a patient's blood, you spin it down to remove the platelets. The platelets are chock full of growth factors, and you take that concentrated growth factor substance and then you inject it into all the areas in the women's private area. And the way that people advertise the O shot is it's like magic. It does freaking everything that you may want it to do. So, for example, here are 4 of the big claims: increased sexual desire, increased arousal, increased lubrication, and a heightened orgasm. Like, that's a lot that injecting your own PRP into you is supposed to do. So what do the studies show? Well, there was a small pilot study on 11 women. This was performed by the dude that trademarked the procedure. So he had a financial incentive to have a positive result. And 71% went from distressed to not distressed. Okay, so they were distressed, I'm assuming, because maybe their sexual experience, was not good due to anatomical reasons, maybe hormonal reasons, stuff like that. And they had this treatment, and they went from "quote unquote" distressed to "quote unquote" not distressed. 11 women, 71%. But once again, this is a guy who trademarked the procedure and sells it all across the country to practitioners who then will advertise it, and I assume pays him a portion of what they make as a way to use that trademark, that O-shot trademark. Now, there are actually a couple of recent studies that have been performed on injections of PRP into the private area and found that it does appear to have a positive effect on those areas. But is it going to really improve sexual desire? I'm not sure how that would be, unless I suppose if you feel better about how things look and feel down there, then maybe that would. Heightened orgasm, I don't know. Increased lubrication and arousal. The good thing with PRP is it's your own tissue. So your own, tissue, because it's from your own blood. It's in general very safe, probably less painful in some ways than the G shot because it's not HA filler. It's not as thick as a HA filler. The thicker the substance that you inject into somebody in general, the more it hurts because you're kind of displacing the normal tissues versus PRP, which is super watery and very easy to inject with a very tiny needle. So if you've got issues down there and you want to try the O shot, it's not going to hurt. I mean, it's going to probably hurt, but it's not going to. It's going to literally hurt, but it's probably not going to figuratively hurt. And who knows? Maybe it will help. Who knows? So I have never done it. I've not seen it. I do know of practitioners who do it. But unfortunately, when you're dealing with PRP and these types of treatments, there's always just a little bit of BS involved in the marketing of these things. And so just be aware. If I had to pick, if you said, hey, I've gone through menopause, maybe you can't go on HRT, hormone replacement therapy, and you're having issues with dryness, sensitivity, lubrication, stuff like that down there, and you don't want to, let's say, use a topical like estrogen cream that can help with it. Would I go with the O shot, or would I go with a vaginal rejuvenation with one of these other treatments? I would probably start honestly with the RF device like a Viviv because it's less invasive and there's probably a bit more science to back it up. Okay, so that's what we can do for the women, and let's now shift gears towards the dudes, to the men. So what do we do for men when we're looking at plastic surgery of their private parts? Well, not surprisingly, for men, these treatments are separated into two things. It's either to make the penis larger or longer, or it's to make the scrotum look better. So we'll talk about the penis first, because the vast majority of these things, it's all about making the penis longer or bigger. Okay, so what is a normal size? First of all, I know you're all wondering, and I know like 70 to 80% of my audience are women, and so you're going to find this maybe kind of entertaining, I think, because Normally we talk about plastic surgery and it's about women, and these procedures, like a tummy tuck is a big operation, and it's kind of horrifying when you think about what we do for it. And sometimes it's kind of nice when we're talking about dudes getting stuff done. It's kind of nice because, guys usually get off scot-free with this stuff. So let's talk about what some guys are doing. And for some reason, everybody has to know about, penis stuff. They find these procedures kind of funny and horrifying at the same time. I think I do too. Okay, so what is a normal length penis? Well, the normal length penis, let's ask the Mayo Clinic. Okay, so the Mayo Clinic, according to Mayo Clinic, okay, and everybody trusts what comes from Mayo Clinic, the length of a non-erect penis does not consistently predict length when the penis is erect. Okay, so if you've got a real small penis when you are non-erect, that doesn't mean that that's going to predict the size of your penis when it is erect. All right, so that's something to keep in mind. You can be small, but then you could be you could be a grower, not a shower. That is a real thing. Now, if your penis is about 5 inches or longer when it's erect, it's of normal size. 5 inches or longer when erect, that's normal. But a penis is considered abnormally small only when it measures less than 3 inches when erect. So if you're less than 3 inches when erect, not flaccid, we're talking erect, then that is abnormally small, and that's called a micro penis. And if you want to know what it feels like to have a micro penis, you may want to ask Dr. Ricky Brown. He's a plastic surgeon in Scottsdale, Arizona. He has that condition. He doesn't. I'm just joking. Maybe he does. I don't know. I've not seen it, but anyways, you can ask him. So that is called a micro penis. So if you want to make your penis longer, I've got actually 5 ways to do that. And we're going to start with the worst way to make your penis longer and then progress to what I think is the best way to increase the length or the appearance that it's longer of the penis. So number 5, worst way to make your penis longer is penis lengthening surgery. Yes, there is an operation where you can lengthen the penis. It works. You start by actually cutting the suspensory ligament of the penis. There's this ligament on the front surface of the penis that attaches the penis basically to your abdominal wall, and surgically you can cut through that suspensory ligament. That will cause the penis to hang lower. And then what some people do, I'm being totally serious, my friends, is that they attach weights to the end of the penis to stretch it out and prevent that suspensory ligament from healing in place or healing back together. Because, like anything, if you cut that ligament and then it heals back together, it can heal and constrict down a bit, and now your penis looks shorter than it started. And now you've done the opposite of what you wanted. So technically, what surgeons would do is cut the suspensory ligament. That causes the penis to dangle a bit more, and then you put a weight on the end to prevent that suspensory ligament from healing back together, and lo and behold, you've got a longer penis. I have never seen this operation done. I know it's being done. It just is, do you really want to be that much longer? Is it really worth it? And I do wonder if cutting this suspensory ligament can cause some type of, some type of instability of the penis. Is it going to flop to the side more or something like that because that ligament is not there to help support it and stabilize it? I don't know. I don't operate down there. Okay. What is the number 4 way to make your penis longer? That is penis stretching. Now, there are studies on this. They are all mixed, and so it's hard to know whether it actually works. Some studies show that you may be able to add up to 1 inch in size after several months of penis stretching therapy. So what do you do for penis stretching therapy? Well, there's 2 things in general. The first one is you can use a traction device. So you can literally go on Amazon and you can get a device that is made to put traction or to try to stretch your penis. There's one brand called Andro Penis. I have zero connection with this brand. I just mention it because it's in my notes. But once again, I neither say that this works. I'm not a fan. I don't know. It's just something I've heard of. And so you literally will stretch the penis, and you have to wear these types of devices for 9 hours a day. So you are literally stretching your penis for 9 hours a day. So you can be uncomfortable for months. I mean, 9 hours a day, it's not 9 hours a day for a week. It's like for weeks or months on end in order to maybe get an inch out of it. And obviously, if you're really manipulating your penis like this, there is a risk of injury. So buyer beware for this type of thing. I do not recommend it. I'm just letting you know about it, but I don't necessarily recommend it. And then there's jelqing. So what is jelqing? Jelqing is basically manually stretching your penis using your thumb and your index finger. And essentially what you do is you start off with your thumb and your index finger around the base of your penis, and you it's like, oh, this is so silly. And you basically pull on your penis as you pull your thumb and forefinger along the shaft all the way out to the tip. And as you get closer to the tip, you technically squeeze the thumb and forefinger tighter as you get farther out on your penis. And then you want to reduce the pressure on the penis if it gets painful. Obviously, you don't want to cause a problem. And you're supposed to do this once a day for about 20 to 30 minutes. 20 to 30 minutes. And yes, there are young people who are jelqing and they say this works. And there's so many other things, honestly, I'd rather do for 20 or 30 minutes than do this. But people are doing it. They want a longer penis. And I don't know if it works. It's just no studies on jelqing have been done, but you can do it if you want to. Some guys do it even if they don't necessarily want a longer penis, I think, too. Okay. All right. So that's number 4, penis stretching. Number 3 are injections of PRP. So just like PRP can be injected in the O shot to supposedly improve the function of a woman's down there, you can inject PRP into the penis, and people will claim that this can cause the penis to look larger and improve their, I don't know what. There's very little data to back it up. There's one study of 58 patients who had PRP injected into their penis, and this revealed an increase in flaccid length by about 1 inch. So 58 patients, you get PRP, you increase by 1 inch your flaccid length. But once again, as I mentioned at the beginning of this part of the podcast, the length of a penis flaccid does not predict how long it will be when it's erect. So do you really care that much how big it is, how long it is when you're flaccid? I mean, I guess some people do. Okay, so that's PRP. The number 2 way to increase the length of your penis is injections of filler. And this is being done across the country. They typically use HA fillers. The thing with fillers is that you are not necessarily increasing the length a whole lot, but you're increasing the girth. You're making it wider. You're making your chubby chubbier, I guess. Yes. Now, filler does last anywhere from 6 to maybe 18 months, and so you can get a long-term result from this. Obviously, there are risks associated with injection of filler into the penis. You can get lumpiness from it. The big risk we worry about is intravascular injection, where you accidentally inject it into a blood vessel. Now, if you inject filler into the penile artery, theoretically, you could necrose your penis, meaning that your penis could get cut off from blood flow, and it can turn black and necrose and die, and you fall off and stuff. That being said, I've never seen. I actually did a literature research, so I prepare for this podcast, my friends. I did a literature search on this to see, has there ever been a case report of somebody getting filler injected into their penis and that filler causing an intravascular occlusion and somebody like losing their penis? And the answer, thank God, is no. That doesn't mean it can't happen. I think theoretically it can, but it has not happened to my knowledge. So filler injections in the penis are being done across the country. I've never done it. I've never seen it. I've never seen anybody teach it, but I know it happens. If there was somebody teaching it, I wouldn't even go to that lesson anyway, because I don't want to do that. But I do think it is going on across the country. Okay, so what is my number 1 way for men to increase the size of their penis? This is much easier, my friends. First of all, shave the man bush. Okay, so some men are very unkempt down there. I try not to see these areas. Sometimes I go to my gym, I go play tennis, and then I have to go back to the locker room to change my clothes and stuff. And then there's always dudes walking around buck naked, which I never understood, like why men enjoy walking buck naked in a locker room when you can have a towel around you, but yet you don't. You just walk around buck naked. I mean, I don't get it. I try to shield my eyes, but sometimes you cannot help and see that there are some massive man bushes out there. And so one thing you can do to make your penis look longer is you can shave that man bush and expose more of your penis, making it look longer. I mean, it kind of makes sense. And so that's one thing. Honestly, people don't like, some, very unkempt down there. There are actual studies that have looked at what people like. And technically, the most popular type of man bush, I guess, is one that is trimmed and clean. Not naked, not like you look like a prepubescent boy, not like you got a freaking, Sherwood Forest down there, but, nice and like well kept, like somebody who pays attention down there, okay? So yeah, doing that can actually make your penis look larger. And then the other way is you can lose belly fat, okay? So some men who have large, essentially guts, I guess, that can cause the penis to look smaller because the pubic area just above where the penis is, if there's a lot of fat there, that fat can make the penis look shorter and even kind of hide it sometimes. And so losing that can help to make the penis look longer. How do you do that? Well, you can obviously do it naturally by working out, by dieting. I mean, now there's like Ozempic and all that crap. But you can also do things like liposuction. You can do sculpture, non-invasive fat reduction. But essentially what you want to do is reduce the fatty area above the penis, and that can make the penis look longer. And so much better than like jelqing for 20 to 30 minutes a day, or God forbid, cutting the suspensory ligament of your penis. Okay, so if you think that was kind of silly, let's talk about the other group of cosmetic treatments that men get done, and that's treatments to their scrotum, to the ball sack. So the first thing is Scrotox. Scrotox is a real thing, my friends, and what that is essentially is injections of Botox into the scrotum to make the scrotum look smoother and to make it hang lower. Okay, because what does Botox do? Botox relaxes muscles. There are muscles inside the scrotum that cause the scrotum itself to shrivel and to have all the wrinkles and all that stuff that they have in it. And if you Botox that, then it will cause those muscles to relax. And what happens? The scrotum hangs lower and it looks smoother. Like, I don't know why some guys are so... need to have that, but apparently some guys do because Scrotox is a real thing. My main concern with getting Scrotox, in addition to it probably really hurting a lot, and I don't want to go through that, is what if you're sitting on a toilet and the water level is really high? Is your scrotum going to actually like touch that water? You got to think about things like this. Okay, so no, thank you. But that is something that's going on. And then there's actually actual scrotal surgery going on where surgeons are cutting off, quote unquote, excess skin of the scrotum to try to make it tighter and to lift it. And I guess if you've got that issue I just mentioned where you sit on a toilet and it hangs so low that you're like touching the water level and stuff, that maybe then if I was like that, I would actually undergo this operation. But other than that, unless you've got, some real condition there, I don't know. It doesn't make a whole lot of sense to me. So these are cosmetic treatments and plastic surgery down there. I hope you enjoyed this overview of cosmetic treatments. I hope you don't feel the need to undergo any of them, but if you do, then all the more power to you. And I hope that I have given you some useful information so that you can make the right decision for yourself. All right. Thank you so much for listening. Once again, I'm Dr. Anthony Youn, and this is the Holistic Plastic Surgery Show. I will see you next week. And as always, remember to eat real food, use clean skincare, and auto-juvenate before you operate.